Colon cancer kills around 17,000 people every year in the UK alone, and 55,000 people in the US. It's one of the most common cancers in the Western world, and here's the thing that makes that number so frustrating from a medical perspective. It's one of the most treatable cancers that we have when it's caught early. The 5-year survival rate for bowel cancer when caught at the earliest stage is over 90%. When caught late, that number drops to below 10%. So the gap between those two outcomes isn't really about treatment, it's about timing. And timing is about recognizing symptoms. And let me just be upfront about something before we get into this video. So this isn't a hypothetical topic for me. I've known multiple people personally who have died from cancer, and some of them were younger than I am now. Now that's not something that I say to be dramatic, it's something that I say because when you've sat with that, when you've known people personally who have died from bowel cancer, when it stops being a statistic and becomes a person that you actually knew, your relationship with early detection changes completely. This is really serious stuff. This is not the kind of thing that you file away and think about later. Everybody needs to know this stuff. The problem is that the early symptoms of colon cancer are really subtle. They're easy to dismiss. People put them down to IBS or stress or something they ate or just getting older. And in the vast majority of cases, they would be right. Most people experiencing these symptoms will not have cancer. But some of you will. And the people who delay things are the ones who end up sitting in front of me in the emergency department or a colleague on the cancer ward with a diagnosis that could have been made 6 months or a year earlier, when treatment would have been significantly more straightforward and more successful. So today I'm going to walk you through 9 symptoms of colon cancer that everybody should know, starting with the most common and easy to overlook, and then working towards the ones that should make you contact a doctor urgently. I'm Dr. Alex, I'm an emergency medicine doctor in the UK, and my mission these days is to help people prevent the disease that I see every day when I'm at work. So let's get into it. So we're starting with number 1, a change in bowel habit. Now, this is number 1 for a reason. It's the most common early presentation, and it's the one that most people rationalize away. What we're talking about specifically is a change that is new and persistent. New constipation lasting more than a few weeks, new diarrhea or looser stools that doesn't resolve, going significantly more frequently than you used to, feeling like you haven't fully emptied your bowels after you've been to the toilet. Now, these things on their own, maybe once or briefly, that's fine, that's life. Your gut responds to stress and diet and travel and illness, any number of things. What flags concern, though, for me clinically is a pattern that has clearly shifted and stayed shifted without a clear explanation. Now, the mechanism here is fairly straightforward. So a tumour growing inside the colon partially obstructs the bowel lumen, the tube. And depending on where it is, that can speed transit up or it can slow it down. It can create a sensation of incomplete emptying because there's physically something there that the bowel is trying to move past. The stool pattern changes because the anatomy has changed. If your bowel habit has clearly changed and stayed changed for more than 3 weeks, then that really warrants a conversation with your GP. It probably isn't cancer, but it's exactly the kind of symptom that, if it is cancer, you want to have investigated early rather than late. Moving on to number 2, and this is one that most people know to be concerned about, which is blood in your stool. But there are important nuances here that are worth understanding properly. So blood in or on the stool can present in a few different ways. Bright red blood on the toilet paper or in the bowl after passing stool. You can have darker blood mixed into the stool itself. You can have blood coating the surface of the stool as well, and all of these represent different causes. Now, the colour tells you something about where the bleeding is coming from. Brighter blood tends to come from lower down in the bowel or the rectum. Darker blood often from higher up, where it's had longer to partially digest and change colour. Now, the important clinical context here is that haemorrhoids or piles are extremely common. Most adults will have them at some point in their life, and they bleed a lot. And so when someone notices bright red blood on the paper, the natural and often correct assumption is haemorrhoids. That is the most likely cause. But the thing that matters clinically is this. Haemorrhoids do not always explain rectal bleeding. And new rectal bleeding should always be assessed rather than just attributed to the most common benign explanation without checking. Now, the pattern that concerns me more than blood just on the paper is blood that appears to be mixed into or through the stool itself, because that's more suggestive of something higher up in the bowel. But regardless of the pattern, new rectal bleeding in someone who hasn't had it before, or a change in the character of the bleeding of someone who has had it before, deserves proper investigation. Particularly anybody over the age of 40 or anyone with a family history of bowel cancer. This is not something to monitor for 6 months and see how it goes. Number 3 on the list is persistent abdominal discomfort. And this one is a really difficult one because abdominal discomfort is one of the most common complaints in medicine generally. And there are dozens and dozens of benign explanations for it. But the key word in this symptom is persistent. Cramping, bloating, gas, ongoing lower abdominal pain. Again, all of these things in isolation and briefly are normal human experiences. The gut is really sensitive. It responds to all sorts of things. But there's a pattern that I see in colon cancer presentations that is distinct from the typical fluctuating discomfort of IBS or functional gut issues. And it's this. The symptoms don't really remit. They might vary in intensity, but they don't go away. They don't have the same connection to particular foods or stress cycles or anything obvious that's driving them. They're just there progressively over weeks. IBS is characterized by variability, symptoms that come and go often in relation to identifiable triggers, often improving at times. Symptoms that are new and persistent and progressively worsening behave differently. And that distinction, while not absolute, is clinically meaningful. Pain or discomfort in the abdomen that doesn't behave normally for that person, that's a reason to go and get checked. Now, number 4 is one that quite honestly surprises people when they hear it in the context of cancer symptoms. And this one is unexplained fatigue. And I understand why it sounds unlikely for a lot of people. Fatigue is one of the most common complaints in general practice, and the overwhelming majority of the time, it's explained by lifestyle and sleep and stress or minor illness. But unexplained fatigue, fatigue that doesn't have an obvious cause and that persists, is something that I take really seriously because of how it can arise in bowel cancer. The mechanism is really slow. It's often chronic internal bleeding. A tumour in the bowel can bleed at a rate that's too slow to be obvious from the outside. You might not see any significant blood in the stool, or it might be intermittent enough that it's not registering. But over weeks and months, that slow blood loss depletes your iron stores. And iron deficiency leads to anaemia, reduced hemoglobin, reduced oxygen carrying capacity in the blood. And the result is fatigue that can be profound and that can exist without any other obvious bowel symptoms. Now, this is particularly important in right-sided colon cancers. Tumours on the right side of the colon tend to present differently from left-sided ones. They're further from the rectum, so changes in bowel habit are less pronounced. Bleeding is more occult, and fatigue with anaemia is often the primary or only presentation. If someone comes to me exhausted and I can't explain it from the history, then we have to check their bloods. A full blood count and ferritin are inexpensive and they tell you a lot. Number 5 builds directly on that last point. And honestly, this is one of the most important things in this entire video for anybody that's ever had blood tests done at the GP. Iron deficiency anemia, which is low iron in your blood without an obvious cause, should be treated as bowel cancer until you're proven otherwise. And I want to be really clear with this. That's not just me being dramatic or trying to scare anybody. This is the actual clinical standard. That's what NICE guidelines in the UK say. And the reason they say it is because if your iron is low and there's no obvious explanation for why, then the most likely reason is that you're bleeding somewhere in your gut. And bowel cancer is right at the top of the list of things causing that bleeding. Now, I knew somebody that was 28 when they died from bowel cancer. This affects people of all ages. Obviously, it's more common in older people, but it's becoming increasingly more common in younger people as well. Now, the reason it's a bit different for women who haven't been through the menopause yet is that they have a really obvious explanation for losing iron regularly, which is their period. So the threshold for investigation is understandably a bit different there, but in men or in women past the menopause, there is no normal reason for significant iron to just disappear. If it's going down, it's going somewhere, and the bowel is the first place any doctor worth their salt is going to look. In terms of how this actually feels, anemia tends to show up as persistent tiredness that doesn't really go away with rest, getting breathless doing the things that wouldn't normally exhaust you, looking pale. Sometimes you notice it yourself in the mirror, sometimes somebody else points it out, and occasionally a racing heart or palpitations. Now, any of those things in someone who doesn't have an obvious explanation for them is worth getting blood tests for. And if those blood tests show iron deficiency, then that should be leading to a proper investigation of the bowel. Number 6 is unintentional weight loss, and this one is a red flag across a whole range of serious conditions, not just bowel cancer. But the key word here is unintentional. Weight loss that you haven't tried to achieve, that isn't explained by eating differently or moving more, this is always something that medicine takes seriously. And in the context of bowel cancer, it matters massively because it can show up quite early before other symptoms have become obvious. The reason it happens is a combination of different things. So cancer cells are genuinely very metabolically hungry. They change the hormonal environment in the body in ways that mess with your appetite. And the inflammation that comes with cancer changes how your body uses and stores energy. So people often describe just not being as interested in food as they used to be, or feeling really full quickly after only eating a small amount. And then they start losing weight kind of gradually without really meaning to. The rough guide that I'd use here is losing more than a few kilos or a few pounds over the last 3 to 6 months without any intentional change in what you're eating or how much you're moving. So for someone who weighs around 80 kilos, then that's only say 3 or 4 kilos. That's not a dramatic amount, and it's the kind of thing that is easy to miss if you're not weighing yourself regularly or you're not paying attention to how snug your clothes fit. But clothes suddenly feeling loose or someone close to you commenting that you look a bit skinny, this is something that's worth paying attention to. Number 7 is a more specific one now, and it's worth knowing about precisely because a lot of people have never heard of it and will never really recognise it if it happens to them. This is called Tenesmus, which is basically the persistent feeling of needing to go to the toilet even when there's nothing actually there, or that horrible sense that you haven't quite finished even when you have. It often comes with this real urgency, like you need to go right now, and then when you do go, almost nothing comes out because there's nothing substantial there to pass. And what's happening physically in the case of colon cancer is that a tumour, usually in the rectum or in the lower part of the large bowel, is sitting there creating the sense of fullness or pressure that the bowel interprets as a signal to empty, even when it doesn't really need to. So people end up going to the toilet again and again with basically no result, which is both exhausting and understandably quite alarming once they realise it keeps happening. This one is really worth flagging because it's specific enough to actually mean something when it goes on for a while. This isn't the kind of thing that comes and goes with stress or a change in diet in a sustained way. If this is new for you and it's been going on for a few weeks, then it needs to be assessed quite urgently. Number 8 on the list is a bit of an odd one. It's persistently narrow or pencil-thin stools. Now, a single episode of narrow stools means essentially nothing at all. Stool shape changes all the time based on what you've eaten, how much water you've had, how quickly things are moving through, even the position that you sit on the toilet in. One narrow poo, honestly, is not something to be losing any sleep over. What actually matters is when this becomes a consistent pattern over weeks. And this is the common thread in this entire video, if it's persistent. If someone notices that their stools have become significantly and consistently narrower than they used to be, and that's been the case for 3 or 4 weeks, then that is a different situation entirely. And the reason it happens is fairly straightforward. A tumour that's growing inside the bowel physically narrows the space that the stool has to pass through. So the stool just takes the shape of whatever gap is left. It's a direct physical consequence of something changing inside your bowel. And sometimes this can be a bit of a later symptom. So it's really, really worth getting it checked as soon as you can. And finally, we reach number 9. Now, this one is at the end of the list because it's in a completely different category to everything else that I've mentioned. This one isn't just a book a GP appointment sort of situation. This one is a surgical emergency. And I need to be really clear about that. So a tumour that has grown large enough to block the bowel, either fully or nearly fully, will cause severe abdominal pain, a visibly swollen and distended abdomen, vomiting that in severe cases can actually smell of bowel contents, and a complete inability to pass anything lower down at all. No stool, no gas, nothing. The abdomen often becomes rigid and extremely tender to touch. You will know if this is happening to you. If somebody has reached that point, they are not in early disease territory. This is quite clearly a late stage presentation of a cancer that has almost certainly been there and growing for a long time. And this, and I can't stress this enough, this is not a tomorrow situation. This is not a call your GP situation. If you're getting progressively worsening abdominal pain and you feel unwell, then this is a call an ambulance situation. The reason I'm including this one at all isn't to frighten anybody about what advanced bowel cancer looks like. It's because there are people out there, I've met multiple people who have been pushing through warning signs for months, convincing themselves that it's nothing, and then who end up in this crisis. Everything in this video is about stopping this stage from happening. So before we finish this video, it's probably worth spending a minute on who is actually at higher risk of this, because risk is genuinely not the same across the board, and knowing where you sit really matters. Age is by far the biggest single risk factor. The vast majority of bowel cancers happen in people over the age of 50, and the risk goes up meaningfully with every decade after that. Family history is also really important as well. Having a parent or a sibling who has bowel cancer roughly doubles your risk. And people with a personal history of inflammatory bowel disease, so that's Crohn's disease or ulcerative colitis, have a higher lifetime risk and should really be under regular surveillance already. Beyond those things that you can't change, there are factors that are genuinely modifiable. So obesity, particularly carrying a lot of weight around the middle, is independently linked to bowel cancer risk. And your diet is super, super important as well. A large European study following over 500,000 people found that high fibre intake was associated with a meaningful reduction in colorectal cancer risk, and a diet high in processed and red meat pushed their risk up. Now, these aren't just vague lifestyle things. These are genuinely connected to whether this cancer develops in the first place. And on the topic of screening, so in the UK, everyone between the age of 50 and 74 is now offered a home fit test through the NHS bowel cancer screening programme. Now, the FIT test detects tiny amounts of blood in your stool that you'd never be able to see with your own eyes. It's done at home, it's non-invasive, and it saves lives. It's a really successful screening programme. If you're in that age bracket and you haven't done yours, then please do it. Please, please do it. Just contact your GP and they will arrange this for you. And if you have symptoms at any age, and I mean at any age, even if you're under the age of 30, then that is a reason to contact your doctor, regardless of whether you're in a screening group or not. The real tragedy of bowel cancer isn't how common it is. It's that when it's caught early, it is so often completely curable, and yet it still kills tens of thousands of people every year because early symptoms get dismissed or minimized or just quietly ignored until they become something that absolutely cannot be ignored anymore. I've watched this happen too many times in the people that I knew personally. This is completely preventable in so many cases, not always obviously, but in a lot of cases. The vast majority of people watching this video who recognize any of these symptoms will not have cancer though. And that's actually the most important reason to go and get checked, because you'll almost certainly come away with a much more straightforward explanation and the peace of mind that goes with that. The people who lose the window are the ones who wait. So if any of these symptoms have been going on for more than 3 weeks, say, then please contact your doctor. In the UK, ask about a fit test. If your GP is concerned, then they can refer you for a colonoscopy. And if you're experiencing the severe symptoms that I mentioned in the last section, which are severe tummy pain, constipation, vomiting, then you've got to go to A&E today. Thank you so much for watching to the end of this video. If you know somebody that is having these symptoms, then have a chat with them or share this video with them, because it might be the most useful thing that you do.